Well, good afternoon, everyone. Welcome. We're so glad to see so many people in this webinar around how we keep the Berkeley community safe. And in this webinar, what we're really going to speak about is how we're going to manage the COVID testing on campus for those faculty, staff, students, and our contract vendors who will be coming back to the physical campus. I'm Dr. Chris Kandus-Fisher, Vice President of Student Affairs, Diversity, and Inclusion. I'm delighted to have two colleagues with me here as well. I'll let them introduce themselves. Eileen, if you want to kick it off.
Sure. Thank you, Chris. Good afternoon, everyone. My name is Eileen Alviti. I'm the Vice President of Human Resources and also a member of the Core Response and Monitoring Team.
And I'm Mark Haas. I'm the Vice President of Operations here at Tufts Medical Center. So we're going to be partnering with Berklee in the spring to help bring everybody back safely in regards to COVID testing.
Great. Well, welcome, Eileen and Mark. Thank you again for being with us. All right, so what we're going to do is hopefully many of you or all of you have also seen our PSA videos that have been going out weekly. We did send one out on Monday that really kind of dove into the testing protocols on campus. And I encourage you to go back and review that video if you haven't done so already. It'll be on our Back to Berkeley page where you can see those from now until the start of the academic year for the spring. So just to give a reminder, before you come to campus, what we're asking everyone to do, we're asking all faculty, staff, students, contract vendors to begin a self-quarantine process at home for 14 days. So you want to avoid contact with anyone outside your immediate household. During that time, we are also asking all community members to complete an online training module. It's really a reinforcement of all the health and safety protocols that we will be having on campus and what the expectations are for you. So you'll get a notice about that in the coming weeks to go in and complete that training module. It'd be a good time while you're self-quarantining at home to go through that and make sure you're up to speed on what the expectations are. As we said in the video, no one is to come back to the physical campus until you're invited to do so by either your supervisor, human resources, or all students will be invited back by a member of the student affairs team. So that's a quick overview about what happens before you come to campus, before we begin the testing protocol. So one thing that came in the submissions of questions prior to when you were RSVPing for this webinar is they asked about how will faculty, staff, students, and contract vendors be invited to campus. So we'll dive into that now. I'll ask Eileen to address from the employment perspective, and then I will talk about how we'll invite students back to campus.
Certainly. Thank you, Chris. So Human Resources has been working very closely with leaders throughout the institution to determine which staff need to be on campus and which faculty need to be on campus. And we've conducted a careful review of that. Faculty have received invitation letters, and we are working closely with our faculty to prepare them to return to campus in January. And this week, we will begin the process of inviting our staff who are expected to be on campus back to work in January as well. So those letters will be going out within the next coming days.
Great, thank you, Eileen. And for students, if you're a residential student, you'll be getting more information in early December, so in the coming weeks, about when your move-in day will be. Those move-in dates will connect directly to your first round of testing that we'll get through in the later slides. For commuter students, you'll be invited to come to your first day of testing as well. So if you're already in the Boston area or living outside of campus, we will invite you back for your first day of testing. There'll be a clearance process that we'll go through later in these slides, but all of that will either come from the residential life team or a member of the student affairs team on your invitation back in the coming weeks and the day that you'll begin the testing protocol and regimen. So all faculty, staff, students, and contract vendors who will be invited back to campus will need to be part of the pre-arrival testing process. Again, we want to re-emphasize, do not come to campus until you're notified to do so. When you come to campus, you will be directed to go directly to the Berklee Testing Center. And the Berklee Testing Center will be on 167 Mass Avenue. It's being constructed as we speak, and we're working on getting that ready and having it all in line with the protocols and safety precautions that our partners at Tufts Medical Center have provided to us, and in partnership with our facilities and real estate team here at Berklee. So one of the questions that came up is, can I come to campus to set up my office or room early? I'm sure Eileen will probably say the same thing that I'm going to say. The answer is no. Look at number 2, our second bullet. Please don't come to campus early for any reason unless you've been approved to do so. And we will let you know when that date is in the coming weeks, but there will be no early arrivals for early setups of your room. And Eileen, I don't want to speak for you, but I'm assuming you're going to say the same thing or something very similar.
I am exactly the same thing. And that's really because we're doing so much work to prepare our campus to ensure that it is as safe as possible. And anyone who is expected to be on campus must follow our protocols before coming to campus. So that all requires an approval process. It will all be timed. It will be carefully orchestrated. So there will be no early arrivals unless approved.
Great, thank you. Another question that was submitted in advance was, can I be tested off campus for the first round of testing? And if so, how do I, or what do I submit for compliance? So we'll talk about this a little bit more in detail. The benefit of getting tested on campus is that Berklee covers those costs. For those of you that are off campus and can't make it to campus for that first round of testing, you'll need to submit, if you're a student, you're going to submit that test saying that you're negative for COVID-19 to the student affairs team. And then Eileen, what do faculty and staff do if they're being tested off campus to provide documentation?
So we hope that most faculty and staff will take advantage of our partnership with Tufts Medical Center and will be tested on campus because the costs for those are covered. But we do expect that some faculty and perhaps even some staff may have difficulty getting to the test center within the required timeframes and may be tested off-site. So if they are tested off-site before they come to campus, we will need to have evidence of a negative COVID test within 48 hours of arrival to campus for work. And those test results should be submitted to, evidence of that test should be submitted to Human Resources, and it will be handled with the highest degree of confidentiality.
And I would just add, Eileen, we want to make sure that the test that's done is a PCR test.
Yes.
So it's very important that wherever you go for that test, that you verify if you are getting it done not at the testing center, that it is a PCR test.
Yes, thank you, Mark.
And just a question flew in saying, can you give the address again for the testing site? Yes, it's 167 Massachusetts Avenue. It's located in one of the spaces that we've previously occupied, but it's being outfitted for our testing site for the spring semester and as long as we need it. So all students, you'll be invited to come to campus on a staggered schedule. So even if you're a commuter student or a residential student, you'll begin to come back to campus once invited to begin your first testing. You'll get a notification from the member of the student affairs team to give you your exact date to arrive to campus, and that will go out in early December. When you get to Boston for the first time, or you're invited back to the Boston campus, you're going to go directly to the Berklee Testing Center and get your COVID-19 test. Students who are going to be living on campus, after you get your first test, you will then go and isolate in your residence hall. So isolation for residential students will begin in your own space that you're living. Commuter students, we will ask after your initial test that you isolate in your apartment or where you're living off campus. All students will then be tested again 4 days later after their arrival, even if their first test was negative. So like before, students will need to isolate until their second test results come in, and then that they've been fully cleared for campus activities. And then they will go into the weekly testing regimen that we will talk about a little bit more in detail next. But throughout the semester, everyone on campus will then be required to take 2 COVID-19 tests per week. Those will be scheduled in partnership with Tufts in a cadence that's appropriate for the test. But throughout the whole year, 2 times a week, and initial onboarding of 2 tests when you initially arrive to campus for the first time. So for some of the questions that came in on this regarding to students, can I have a family member with me for move-in, and how long do I have to move in? So yes, each person who is a residential student can have 1 family member assist in the move-in process. The move-in process for each person in the window that will be provided to you will be 2 hours long. So it's a quick move-in. This is not an all-day move-in process that families and students have been accustomed to. You're going to come in, you're going to move in, and then you're going to be isolating as we go through the results of the baseline testing. Family members, I know in a previous webinar that I hosted with parents and families, families were asking if whether or not after the student gets tested and move in, can we take them out to dinner? The answer is no, unfortunately. We want to make sure that we safeguard the community the best that we can, and we have to be strict about the health and safety protocols that we've designed and put in place. So any farewell dinners should happen at home before you arrive to campus. Do your celebrations at home while you're self-quarantined at home before you come to campus. But once you come to campus, you're tested and you move in. Unfortunately, that's when we have to say goodbye until we get through that quarantine process.
Can I just add to that, Chris? One
yeah,
thing
go ahead, Mark.
We want to avoid family members coming to the testing center for your first test as well. I think sometimes families want to see what it looks like. That's not a good idea. They won't be allowed in. We're just having the students, faculty, and staff that need to be tested come in. We want to make sure that the appropriate distance is kept. And so family members, it's not a good location for them to come. So do not plan on parents coming to your test.
And thanks, Mark, for that. We're going to actually show some pictures later in this presentation of what one of our close partner schools, Emerson and Tufts Medical School, they have their own testing site that's in the Boston area. So we have some photos to show you what it looks like. So parents and families, if you're curious. And then we're also going to show you a video the Broad Institute put together about what the testing looks like as well, so you have a visual. So there's really no need to come in to the testing facility unless you're a student, faculty, or staff member required to do so. When will testing begin for students, residential and commuter? So it will begin in early January, again, staggered in. We will let you know when that first test will happen for each student, but we will start that in early January as we phase the campus back into the physical location. All right, Eileen.
Okay, thank you, Chris. So like our students, we are putting a very rigorous testing program in place for our faculty and staff and our vendors who are expected to be on campus. And we are phasing our faculty, staff, and vendors in very much on a staggered schedule as well. Anyone who is working on campus, whether it be a regular weekly schedule, an as-needed schedule, or a limited schedule, will be subject to regular safety protocols and regular testing. So I want to just provide a few details related to that, because faculty and staff who are on campus regularly each week will be expected to receive testing twice per week. Everyone who is starting work must be tested prior to beginning work, and will have to be tested at the center, hopefully, and have test results 48 hours in advance of starting work. We ask before you begin work that you isolate at home and stay only with your immediate family members, and that's really to help us minimize the risk of the spread of infection, so that when you come and are tested, that you'll get a negative test result. Once those negative test results are confirmed, you then will be able to begin work. Some of our staff and some of our faculty may only be on campus once per week. So those individuals will be tested once per week to ensure that they are negative tested on a regular basis to minimize the spread of infection. And then some of our staff may only be on campus as needed. And for those who are only on campus as needed, they will need approval from the core response monitoring team and their direct supervisor to come to campus on an as needed basis. And those individuals too must provide a negative test result within 48 hours of their scheduled workday on campus, and they must complete a self-attestation to ensure that they have no COVID symptoms. In very rare situations, it may be expected that a staff member must come to campus emergently to handle an urgent issue. And we will handle those through the core monitoring and response team on a case-by-case basis to ensure that any faculty or staff member who has to come to campus on an emergent basis will be safe to do so.
Great. And Eileen, who will, again, just to reemphasize, who will be paying for employee, faculty, staff, and student testing?
Yes, so Berklee will be paying for all tests that are conducted through the Tufts partnership and the Tufts Medical Center on-campus facility. If there are circumstances where a faculty or staff member cannot get tested in that facility and must do it elsewhere, there may be local community organizations, et cetera, that provide the required test for free. But there may also be a cost for that if you're doing it off campus. And Human Resources is happy to consult with you and help provide resources related to that if that is necessary.
Mark, this is a question that came in, but I think we'd feel like you could answer this one. Since you've been working with other schools that have opened in the fall, the testing cadence and format that we just shared with the group, it's almost similar to or exact to what other schools have done and the success that they've had with it. Can you talk a little bit about that baseline testing approach and then the cadence approach and why that's so important and is working based off of your experience so far?
Yeah, and so I think that's one thing, as everybody should know, is that we've done this now for a semester to great success. So our positivity rate with the schools we're working with and those students is way less than what we're seeing in the community. And so it's really helped these schools return the students safely. And so we feel like we've written this protocol for the first time when we did it last semester and have the workflows down pat and understand the cadence. The cadence is mostly based on the science and what we see as far as positivity rates and what that surveillance testing amount is tied to how much interaction students have in group living settings, in classroom settings, et cetera. And so there's been a number of scientific papers written that talk about twice a week or once a week at a minimum being the appropriate cadence for college students that are going to be living and cohabitating and frequently in a common setting, such as a classroom setting, that cadence seems to be the sort of sweet spot on which you're able to quickly identify somebody that might be asymptomatic positive. That's really what you're looking for, so that they can be removed necessarily from a setting where they're at risk for infecting others. So that's where this level of testing has proven to be very successful. And like I said, we've had less than a 1% positivity rate with the schools that we've been doing this with so far, which has been very good.
One more follow-up question, Mark, on that. Some of the schools that opened this fall in the Boston area, they did the baseline testing as we explained, that series of testing to make sure we could find out what our foundation or our base positivity rate is in the community. And then they did a weekly test. But now you're seeing more institutions moving to what we're coming out with right away as a twice a week test. Can you just talk a little bit about what happened there? Why are schools doing that, and why you feel it's a good move that Berklee is moving to twice a week cadence?
Yeah, I mean, some of it has to do, with the science and what we've seen across the country with the schools that we're doing 1 week versus 2 week, and to what degree you have a better opportunity to capture some of those asymptomatic positive students or faculty or staff, right? So if you're doing twice a week, then you're increasing the opportunity to actually catch somebody early in their infection period and able to prevent them from going into a setting where they may be more contagious. So the twice a week really has become kind of the gold standard for the colleges, and Berklee wanted to go that route. I will tell you, one of the schools we worked with was doing once a week. They were fine as well, but I think it's more that what we're seeing is the standard being the twice a week.
Okay, there's been a lot of questions around compliance and how we will monitor and manage that as an institution. So if you miss a COVID test, your campus access may be suspended until you produce a negative test result. What we're really hoping for is that people are being very mindful. The tests are important. We're going to be holding you accountable to that. If you're coming to campus, the testing protocol is not negotiable. And I don't want to sound too harsh, but again, we're talking about the health and well-being of our community, and compliance is really important. Consistent and blatant lack of compliance could result in further disciplinary action for all community members. So we're talking about faculty, staff, students, anyone that's on campus. The disciplinary process could be something that we implement depending on how consistent and blatant lack of responsibility is shown. Throughout the semester, everyone will also need to submit a daily attestation. A self-attestation is your starting point of how you begin to access the physical campus. Failure to do so, again, may result in campus access restrictions. The way we are working through this, and there'll be more information to come on that, about you'll have to go into the daily attestation. You can either access that on your phone or your computer. You're going to have to attest that you are symptom-free and that you're well enough to be on campus that day. Every day that you come to campus, you need to complete the self-attestation. It's really important. Access will begin once you complete that and you have a positive go to come into campus. Once we receive it, like I said, you'll have access to campus facilities. In addition, for students, and then I'll pass to Eileen to really talk about how we'll be managing employees. All students, there'll be a progressive disciplinary process for those who don't follow the health and safety protocols. Of course, we want this first to be educational, but again, the blatant disregard of the compliance will have to elevate community standards, violations, and sanctions. We're hoping that everyone will take a shared responsibility to this and that we do not have to take those actions, but we are prepared to do so. So students, I'm asking you to really think about your community, think about each other, think about the safety and health and well-being of yourself and those people that you care about that are at Berklee, and please follow the protocols that we've put in place. Eileen, do you want to speak to the employment compliance aspect?
Sure. And Chris, I think you said it nicely when you said we all have a shared responsibility, because that is really the philosophy behind how we are approaching our faculty and staff as well. We know that every behavior that one exhibits could be very helpful in terms of minimizing the spread of infection and could actually save lives. We know that wearing masks saves lives. We know how important testing is. And we are going into this spring semester with the understanding that people understand that, people that are working on campus understand that, and they are going to follow all of our health and safety protocols. We have a number of reporting mechanisms that we are going to set up to allow people to safely and comfortably come forward to report any situations that they see that may be unhealthy or may be a violation of our expectations. And we are going to take those very seriously, and we are going to address those if they are occurring. Our corrective action policy and process for faculty and staff will be the foundation for how we approach non-compliance related issues. Non-compliance could result in removal from campus. It could result in corrective action up to and including termination. We hope that will not be the case because we understand how important it is for everyone to be a part of keeping our community safe. Human Resources is available to speak with anyone regarding any of our faculty and staff expectations and how we plan to move forward with those in the spring semester.
Great, thank you, Eileen. As we said, the Berklee Testing Center will be located at 167 Massachusetts Avenue. The Berklee Testing Center will be staffed by professionals from the Tufts Medical team, and Mark will share a little bit more about how that all works. They'll be providing the testing oversight and follow-up care to our community. They'll be the ones at the testing site monitoring the compliance of how the test is administered. So they really will lead everything at the testing center. You should feel very comfortable with that team. We've really enjoyed our working relationship with Tufts in the past years. They've also been the ones that have provided our basic routine care to our students previously before COVID. And so we're delighted to expand our partnership with them. So Mark, before we get into some of the questions that were already submitted, do you want to bring a little bit more depth to, how the testing process will work administered by Tufts, and then also a little bit of what happens with the follow-up care pieces of it?
You bet. So I'm sure there's anxiety, both students, faculty, staff around this. I can tell you that your anxiety should be alleviated. There should be no fears about this. We've got this down pat from the past semester. Everybody will arrive to the testing center. They will need to be masked. So you will have to be masked, as we require here in the Commonwealth of Massachusetts as well. When you first enter the door, you're going to get a squirt of hand sanitizer to sanitize your hands. And then you're going to be asked a number of questions on whether or not you have any of the symptoms, very similar to your daily attestation. But we will also ask if you have tested positive in the last 90 days. That's not to put a scarlet letter on you if that's the case. It's more, you don't need to be tested. And we'll give some more information about those that have tested positive in the last 90 days. We want to save resources, and there's no need for you to be tested again because you potentially will be positive, and therefore it's actually a bunch of cascade of events after that. But in any event, assuming you haven't tested positive in the last 90 days and you don't have any of the symptoms, then you'll move along in the line. You're going to swipe your ID badge or tap your ID badge, and it's going to print a small barcode with your name and date of birth on it. You'll verify your name and date of birth is correct, and then we'll move you into one of our what's planned to be probably at least 12 testing bays. And in that testing bay on a table in front of you will be a test tube and a Q-tip, just like the cotton Q-tips you use on your ears, etc. It'll be just like that. You're going to take that Q-tip, and it is an anterior nasal swab only. So you do not go deep into your nose at all. You're going to see on the video, you just swirl it 3 times at the front part of your nose in one nostril, same Q-tip 3 times in the other part, and then you stick it with the Q-tip down into the tube, cap it, and then you're going to leave it on the table. We'll give you one more squirt of hand sanitizer, and then you're good to go. Whole process is 3 to 4 minutes is what we're seeing, so it's a very quick process. We then take it from there, and we take the test tube and we send it off to our partner, the Broad Institute, where the test is going to be done. The results come within 24 hours, generally. Sometimes it can be up to 48 hours. One thing I want folks to be aware of is there's sometimes what we call a TNP, the test was not processed, or something happened where the Q-tip was put upside down, potentially too much was on the Q-tip and they could not run the test. They give what's called a TNP where they could not process the test, and those students will be called directly to come back in for a retest. The challenge comes in sometimes during that first week when you have to have 2 tests to clear yourself. Sometimes this causes a little bit of a delay in that, but we will work to get you tested quickly. We plan to be open at good hours for 5 days a week at least. In the early on, we might even have the weekend hours as well. We're working with Chris on what those hours will be. But once you get the test result, you get it via portal. So you'll log in, you'll be able to see your negative results. We do not call you if it's negative. If it's positive, one of our physicians from our infectious diseases department will call you directly and talk to you about what the right next steps would be as far as what you should avoid, what you can and can't do. Also let you know that you're going to hear from contact tracers at the college shortly after we hang up with you. But really it's to assure you that if you tested positive, what you should be looking out for, what is available to you in the event you need treatment, when should you be concerned, what is there not to be concerned about, so you can ask any questions you want to this infectious disease physician. So that's really the key thing, is to make sure that you're comfortable with the information. And then contact tracers will contact you after that call. So all positives will be spoken to directly by a physician. One other thing I want to say is if you do arrive at the testing center and you tell us that you are feeling symptomatic, we actually then will take you for a telehealth visit with one of our physicians as well. So we have a room dedicated where you'll go in, you'll have a private conversation with the physician, and they will determine whether or not you should come to the medical center for an actual diagnostic examination. And we may do our COVID test there. Our COVID test at the medical center has a much faster turnaround time. So if somebody's symptomatic, we want to know faster than the 24 hours, whether or not this is somebody that should isolate and potentially quarantine. So we will have a telehealth visit with you, send you over, we'll provide the transportation over to the medical center where you'll meet with one of our physicians directly for our COVID test and also for an assessment. Listen to your lungs, perhaps see if it might be something else going on. We don't anticipate having to draw blood or any of that, but if we need to send for a chest x-ray, we'll do that as well. So you'll have access to all of that care if you're symptomatic or if you do turn positive with the test result.
Great, thanks, Mark. That was a lot of detail. We really appreciate that. So I'm just going to make sure I'm able to cover some of the questions that were permitted. I think you covered the first one. I heard that Berklee with the Broad Institute. Can you talk a little bit more about how that Broad relationship works? Because I think some folks and family employees and students are confused about, well, I thought Tufts was administering. What is the Broad doing?
Yeah, so the Broad actually owns the test itself. And so they have been able to partner with, I don't know too many schools that are not using the Broad, I'll say that. Even our hospital uses the Broad for some of our patient tests as well. And so the Broad has a proprietary test that they can use for a 24-hour turnaround time. It has very high sensitivity, that it's proven to be very sensitive. And so great confidence in it from a scientific standpoint and from an infectious disease and epidemiology standpoint. It's worked very, very well. They have the ability and the technology to process a massive number of tests. At one point during this last semester, it was 1 out of every test done in the country was being done at the Broad. So they have incredible capabilities. And 100% to their credit this semester, they were able to keep up with that 24 to 48 hour turnaround time. So we have great confidence it'll continue. They've done a very good job being good partners with the colleges. They also work with the hospitals. They work with nursing homes. They work with a lot of different entities across the entire country. We're lucky that they're here across the river over at MIT, but they work with a lot of places across the country that are sending their tests here for their quick turnaround time.
Great, thank you. Another one that was pre-submitted, Mark, does the test hurt?
I promise it doesn't. I'm sure it's probably been a long time since you've stuck any, when I was a kid, I used to enjoy sticking things up my nose. I won't go down that road right now, but the Q-tip, really only the very top of the Q-tip, the head of the Q-tip, the soft part, it only goes just inside the nose. It does not go deep at all. It is an anterior nasal swab. And so this is not something that's going to be tickling your brain at all. I promise this does not hurt. We've had 0 complaints. Nobody has said it hurt. And you do it yourself too. So it's not somebody else doing it. We observe and we provide instructions. That's what our clinical team is there to do, is to make sure that you're doing it right so that we don't get so many of those TNPs that I talked about, tests that actually have to be redone. So we provide all of that observation and assistance during it. But you do everything yourself.
Okay, great. And I think you answered the last question. What kind of test is administered? Is the nasal swab PCR test. So the one that maybe came out in the beginning where everyone has seen on the news or in the media, the very invasive one that you talked about, that's not the test we're administering on campus. So we're going to actually show a video of how it works later in this webinar in a few minutes. Here are some images. So Mark, one of your team members, Emily, sent these images to us about the site. Do you just want to kind of briefly talk through what people can see on here? It's not a perfect image anyway, but I thought it'd give some highlight about how it could look for folks when they come to the Berklee testing center.
Yeah, so what you're seeing is one of the bays where you see the number 10. And so we plan to have probably 12 testing bays. We load them up about, probably 6 at a time. And so they go in, and then just as I said, the tube will be on the table when you arrive. You can sit if you choose to, you can stand. We pass out then a Q-tip, so you'll do the swab, and then you'll leave it on the table when you leave. But this is just, the one thing I didn't mention, you do have to blow your nose before the test is done. So that's one thing that's a little a little awkward, but that's why the trash can is there. We give you a tissue to evacuate your nose before you actually do the swab. It's just to prevent any contaminants that go into the test tube. But these are just small bays that you'll have for every 12 person. We load them up and observe everybody and give instructions at one time, and then you're free to go. Like I said, it's been taking between 3 and 4 minutes max from the time you walk in the door and get screened to the time that you actually leave the testing center. We keep social distancing with the line, so you'll see numbers on the floor. They're all 6 feet apart. Everybody is masked. You cannot enter the facility if you are not masked. So we make sure that people keep the appropriate distance as well. We have the appropriate ventilation in the facility, in the space, and we're very careful about hand sanitization throughout the process. The key thing also is there's unidirectional flow, so there's no crossing of people. So we've set up the 167 site that Chris talked about. We've set it up so that there will be a single flow as well. You never backtrack and go backwards, so you're not crossing lines or crossing over people.
Okay, great. Thanks, Mark. I'm going to try to answer a couple questions. There are so many questions. Great in the Q&A. Some of these things will be addressed in upcoming webinars. But I'm going to answer a few of these before we go to the next slide. Does the self-attestation apply to on-campus students? It applies to anyone who's accessing our physical campus, faculty, staff, students, contract vendors. But remember, anyone who comes to campus, even if your classes, if you've signed up where you're going to be in Boston accessing facilities, but maybe you've decided to enroll in all online courses, if you're accessing any of the buildings, all of this still applies. You still need a testing protocol. You still need to do the attestation. So anything that we've talked about today, if you access the campus, it applies to you. It applies to every member of our community. If all classes end up being remote, or if I pick all classes that are remote and we live off campus but live in Boston, do we still need to get tested twice a week? If you are accessing the facilities, yeah. And it also means the symptom checker as well. So all of those things apply to you as well. Let me just try to see if I can go through a few other COVID test, rapid test, or nasal swab. Mark just answered that. It's the nasal swab with about a 24 to 48 hour turnaround time. Is that about right, Mark? Okay.
That's correct. Yep.
All right. I threw this in, Mark. This kind of spoke to exactly what you said earlier about the percent positive in Massachusetts, according to the Massachusetts Department of Public Health. You'll see that really right there, and correct me if I'm wrong, Mark, if I'm reading this incorrectly, that bottom line, that light blue line, is the positive rate for higher education communities. And it really speaks to the approach that we're taking with the amount of testing and safety protocols that schools are putting in place, why institutions had such a high success. You know, there's been a lot of information on the news where you see schools that are shutting down, but the majority of schools have made it through the fall semester with a great deal of success because of the work that we've been sharing with you and the approach. But Mark, you know, do you have any comments on this data and this chart that I didn't mention?
Yeah, and I think I saw a question pop up about the numbers in Massachusetts increasing. And so, yes, that's true. I think it is across the country, there's no doubt. But one of the things that the Department of Public Health published was the reason that the numbers have been increasing in Massachusetts. And far and away, the lowest on those reasons for numbers going up were the college programs because of what we have in place. The number one has been those family get-togethers and small group gatherings that we're going to tell the students and everybody to avoid those gatherings. And so those are the things that are the number one spreader in Massachusetts. Restaurants have been a little problematic, movie theaters a little problematic. Colleges have been way down at the bottom of the list of what they can trace back to these clusters of positives that they've been getting. So like I said, we've had, I don't mind sharing with you, a 0.8 and a 0.9% positivity rate, which has been tremendous at the colleges that we're working with. So it's really been a good testament that this has been the way to go. And it gets at what, you know, Chris was asking earlier. You were asking earlier, Chris, about the twice a week and the gold standard. I think that's what Berklee's choosing to do to get to those 0.9 percent positivity rates.
All right, this is a video just to share with you how the Broad test that we've been talking about this whole time is actually administered. So we thought it'd be a good video just to share with all of you so you have an understanding of what the test looks like. It's more of in a character type of format, but I think you have a good, this will give you a good example of how it'll all work. Great. You can also go to the Broad Institute directly. They have a ton of informational videos of what the work that they're doing there and how the process works if you'd like some more questions on that, or have more questions on that. Mark, there's another question that came in. Can you talk one more time about the test administration? So, you know, this is going to be monitored by clinicians, and I think people are wondering, is that the safest way to approach this? You know, are the medical staff wearing PPE to avoid contamination? You know, is there ways that this could go wrong because of the self-administration on it? Can you just talk a little bit more about that?
Sure. And so at the medical center in particular, we're very careful, obviously, because we are still seeing a lot of patients at the medical center. So it's all of our personal protective equipment, PPE, that we use. The staff that you see will be masked, of course, with a clinical grade mask. They will also have goggles, so that eye protection is key for us in particular in encountering any potential positive patients. So they will all have all of that personal protective equipment, the same that we use at the hospitals as well. And the staff that's going to be providing the instruction is going to be some of the same staff that we've been using at our existing testing center as well. So we plan to kind of break that group up and put half of them over at Berklee so that they're there, especially during the first couple of weeks as students are learning this test themselves. I promise by the end of the semester, you're all going to be so quick with this and know how to do it. The key reason why we have clinicians assist and clinical staff assist at the beginning is to avoid those T&Ps that I talk about, because if it still can be a sensitive test, and if it's not done 100% correctly, then you're going to get a test result back 24 to 48 hours that says you got to be retested. And that's going to cause some problems. So we want to make sure that the test is being done right the first time. And then once everybody's sort of acclimated to the test and adept and adroit at it, then we don't have to be as involved in it. There still will always be staff there to answer questions. But we're always there with a nurse who will also be available for the screening and the triage, like I said, and also anybody that does appear at the testing center and says they're symptomatic, we're going to take them into a room and we're going to do a televisit with them, a more in-depth triage of them, and decide whether or not they should go to the medical center for that faster test. The other thing that I didn't mention that's important for you all to know is that you will get a telephone number that will be manned throughout the day by our team. So our clinicians, you can call at any time, even on the day when you're not scheduled to come in for a test, and say, I woke up this morning, these are the symptoms I'm having. And then a nurse will triage that and decide whether or not you should meet us at the medical center and be treated, or potentially even just coming to the testing center for another or additional test. So what you're really getting with our partnership is that sort of peace of mind that there's clinicians, physicians from our infectious disease department, nurses, nurse practitioners that are available not only to answer your questions, but then also to treat you in the event that a test is positive, or if something else is going on. We can also obviously diagnose that it might be something non-COVID that you might need treatment for.
Thanks, Mark. That was really, really helpful. When you talk about those tests, a couple questions came in that are not able to be read. How often does that happen? The percentage of that does seem to be still pretty low, but could you confirm what you all are seeing, through the lessons learned this past fall?
So what we've seen is that when it is done unobserved and without clinical support, that TNP what we call TNP, tends to be between 5 to 7% of the time. When it is done observed, we've seen less than a 1% TNP rate. So it's been about 0.75 as of late, especially as of late as we get further along in the semester. So having the clinicians there to sort of observe and make sure. Also, we QC every tube to make sure, believe it or not, the most common mistake is that people put the Q-tip upside down in the tube. That will not work and it has to be re-swabbed. If we notice that as we're packaging everything up, we actually call you that day and say, come back in quickly before, so that we don't have to wait 24 to 48 hours to know that your test didn't work.
Okay, great. Let me see. I'm trying to get through. There's some questions in here about what if a vaccine becomes available sometime in the spring? We haven't really talked about how we would go about that, but Mark, are you in the Tufts Medical Center thinking about, if a vaccine becomes available and you're working with all these schools, what could be, and we're not going to hold you to this because we know that there's still a lot to go through, but how would that happen with a community like ours, or could possibly happen?
Yeah, so I've already started to talk to our pharmacy office and our department at the medical center about knowing when this vaccine will be available. And it unfortunately is a little bit out of our hands as far as the prioritization. We still don't know how the federal government is going to do this, or even the state Department of Public Health. We've had some experience with this, with some of the treatments for COVID, like remdesivir, Regeneron, some monoclonal antibodies, and how they've chosen to distribute that. So we have a basic understanding of how they would probably do it. But I think one of the key things is that we have a relationship now with Berklee, just as we do with the other colleges. And so we have you at the forefront of our mind as far as how we would handle a mass vaccination, potentially a vaccination clinic, how we would roll it out. But the big caveat is we have to go by what the government tells us that prioritization will be. Are college age students going to be high on that prioritization list? Probably not. Will they be higher on the list because they live in potential, conglomerate settings? Maybe they're higher than others. We just don't know for sure yet. But there's a lot of people that are involved in that decision making, and when we do know, I think we already have these partnerships with the schools. So we will start working with. The first call will be to Chris to say, how do we start setting up vaccination clinics and how do we get people vaccinated quickly? Whether that be over the summer, whether that be next school year, whenever that is, we still don't quite know. There's a lot, just so you know, too. We're struggling a little bit. The two vaccines that you're hearing the most about in the news, the Moderna vaccine and the Moderna one in particular requires very cold storage, and it breaks down very quickly outside of that freezer storage. So some of those might not be necessarily viable to easily administer on campus, and we might have to come up with other plans on how we get those vaccines done. But again, that's all, in the future, hopefully the near future, but we'll work with Berklee to get through that.
Okay.
Thank you. Someone just corrected me. It's the Pfizer one that has the cold storage, not the Moderna. Somebody obviously knows this better than I. That's true.
Very good. One more question we're going to take, and I just want to give a quick update on next steps and future webinars. A question came in about the flu shot. So really good question. All students are going to be getting a communication in the coming week. I think it's going to go next week to also need to make sure that your immunizations are up to date including that we're requiring all students the flu shot. It is a mandate that's come down from the governor that all students all the way through higher education institutions like Berklee have to get the flu shot by 12/31, so December 31st. So there'll be information about that being sent to you and how you submit that documentation. It is very similar, students, parents, and families that are on this webinar. The same process that you go about by submitting your immunizations is the same process you'll be doing to submit the flu documentation. So more information on that. But it's really important. We'd like to know what we're managing in the spring, and it would be helpful to know that you've done what you need to do to prevent the flu as much as you can, so we really can determine what's happening with your overall health and well-being. Mark, any final comments about the flu shot? Any recommendations from Tufts on that one, or does that cover it?
Definitely get it. That's all I will say. Definitely get it.
Great. So we're almost out of time. I know that there are still questions flowing in, and we've been collecting all these questions and trying to answer them on our FAQ that's on the Back to Berklee webpage. So please go back and check that out. We will try to answer a lot of these questions. Weekly, we'll be continuing our video series. The next one that's going out on Monday, we'll talk about our contact tracing protocols and the steps that we're taking at Berklee to trace positive cases. We will also have a future webinar and video around our isolation and quarantine process and how that will work. We will have another webinar and video that will follow that will talk about the physical campus. So we'll show you snapshots and films of what the campus is going to look like, so you're familiar with our safety signs, the flow of buildings, what classrooms will look like, so you can get comfortable before you come to campus. We will also, Eileen and I will be hosting a faculty and staff focused webinar in the coming weeks, so more information on that. But again, we are going to keep going through this process of education so you have a good understanding in small snippets of what this process will look like when you return to the spring. So hopefully by the time January hits, we have answered all of these questions and really addressed the most concerning things that you're bringing forward. But Mark, thank you so much for joining us. We appreciate your continued partnership at Berklee. Eileen, any final closing thoughts that you want to throw out there before we say goodbye to everybody?
Stay safe, be healthy, and we really look forward to the spring semester. Thank you all. Thank you, Mark and Chris, also.
Thank you, everyone. We'll see you soon.